Hi, I'm Dr. Mirrafati from Mira Aesthetic, continuing the series of educational video about breast surgery, breast implantation, augmentation. Today's question is, how does weight change affect breast implant? How does weight change changes breast implant? That's a very tricky question. You know, if you're just gaining about 10 to 20 pounds, it's probably not going to affect that much. If you're losing about 10 to 20 pounds, probably not so, because you know, the breast is not really fatty, it's glandular breast. So by losing weight, the gland doesn't change. However, in between all this gland in your breast, you also do have some fatty adipose tissue that it can change with weight gain or weight loss. So when you have a massive weight loss, or anything about 60, 70, 80 to higher than that, it can cause sagginess of the breast, because the breast that was full down here with an implant, maybe laterally, medially, and superiorly, now is all of a sudden you lost some volume of the fat is gone, and it could feel a little sagginess underneath here, or when you're bending over, you might see a little rippling on the side because you don't have as much cushion to show. You don't have as much coverage. Therefore, the implant becomes more exposed, if you will. It felt more because there's not that much coverage on that implant. However, if you do gain the weight, I'm not talking about 10 to 20 pounds, if you're gaining, about 50, 60, 70 pounds again, then you might look very top heavy, because for the same token, as I said, the breast tissue is mostly gland, but you do have some fatty adipose tissue in between the glands. So it might be very top heavy. You might even laterally, especially right here in axillary area, the people come in and say, I'm massive around here. I want to do a breast, go lower on my implant. It's not the implant. Implant just didn't grow. It's the fatty tissue, especially right here where you have a combination of fat and gland, that as it's enlarging and making the look of this implant top heavy or very gigantic. So in a nutshell, if I were to summarize it, weight changes, anything in a moderation, anything up to 15, maybe even 20 pounds, you're not going to see much difference, especially if it's done correctly. So if you purport it, like in here, Mira Aesthetic, we go from the armpit, we're not even touching the breast tissue. So, if you lose 10 to 20 pounds, the effect of it is minimal. You won't be able to feel it or detect it with the naked eyes. But if you go above 50, 60 pounds, if you reduce that much, you can have some sagginess, some more feel of the implant, because you don't have as much cushion. On the other hand, the same thing, if you gain it and gain, moderate gain, nothing, heavy gain, you can probably feel it. So if you're doing an implant, just try to stabilize your weight so you don't have too much of fluctuation. Stay well.